Thank you everyone for joining. My name is Kaelan, and my role here at McMaster Health Forum is lead Health Systems Evidence and Learning. Today's presentation has been organized as part of the Labarge Optimal Aging Initiative, which aims to keep older adults healthy and active for as long as possible. One of the key elements of this initiative which will be the focus of today's webinar, as well as the webinar that we had last week, is the development of a resource of information for aging Canadians called the McMaster Optimal Aging Portal. The aim of the portal is to ensure Canadians know about and have access to high-quality information that can help them remain healthy, active, and engaged as long as possible, and to manage their health conditions. The portal aims to be a trusted voice on optimal aging for citizens, clinicians, public health professionals, as well as policymakers. As Julie mentioned, please feel free to use the chat feature if you have any questions about the portal as we go along. I'll make note of them as we go along and share them with Maureen at the end during the designated time for question and answer that we've set aside at the end of the presentation. So I'm just waiting to make sure that the feed goes through, but I'd like to introduce Dr. Maureen Dobbins, who is an associate professor in the School of Nursing at McMaster University. Her research efforts currently seek to understand knowledge translation among public health decision makers in Canada. Her program of research has identified barriers and facilitators to research use, explored the information needs of public health decision makers, and developed, implemented, and evaluated a variety of knowledge translation strategies for public health decision makers. Since 2001, she has been the scientific director of Health Evidence, and on January 1st, 2012, she also assumed the role of scientific director for the National Collaborating Center for Methods and Tools. This center provides leadership and expertise in sharing what works in public health and helps practitioners to find and use innovative, high-quality, up-to-date methods and tools for sharing what works in public health. Today, the focus of her presentation will be on how to use the Web Resource Ratings feature of the portal, which, if you tuned in last week, Dr. Anthony Levinson briefly mentioned. And this feature helps those users sort through the masses of health-related information on the Internet in order to identify only the most high-quality, trustworthy, and reliable information about optimal aging. Maureen will present for approximately 40 minutes, and then, as I mentioned before, we'll have time for questions. So please feel free to use the room chat, and I'll note your questions down and flag them for Maureen at the end. So as I mentioned, the objectives are to introduce the portal's Web Resource Ratings feature. And with that said, I'd like to turn the presentation over to Maureen.
Thanks very much, Kaelan. Well, it's my pleasure to have the opportunity to talk to you today about the portal and specifically the web resources, and also I'm going to talk a bit about the expert blogs that are being written, or I really should call them blogs, and really just to provide a little bit more context to what Anthony Levinson presented last week. I'm going to apologize right off the bat because we have some of you are returning from last week and some folks are new. So I feel I need to give a little bit of background of what the portal is about. So there will be some slides that should look very familiar to those of you that were on the webinar last week, but I'll try not to spend too much time so that we can get to some of the nitty-gritty about the web resources. So my team really has been focusing a lot of effort in terms of understanding how to assess the quality of information that folks can access on the Internet, and really in a systematic way and in a way that we can justify our assessments, assess the quality of that. So we've been trying to use really quite a rigorous approach to develop a strategy to evaluate the quality of health information. Quickly, really, about what is a portal, and Kaelan gave us some beginning direction on that, but in essence, a portal and how we've really tried to visualize it here is trying to put in one place all of the relevant information, in this case related to optimal aging. So we're putting it all in one place so that you can access it as much as possible with one click of your mouse. For those of you that haven't been on the site yet, this is what the homepage will look like when you access the homepage of the Optimal Aging portal. And I really encourage you, if you haven't been there before, to take a listen to the short video that you can see on the slide here. This gives you a minute and a half quick description of what the portal is all about and what you can access there. So who is this portal for? And really I'm going to focus today's presentation around 3 examples, and you would have seen these faces last week. So the portal can be for someone like Linda, who's interested in wellness, who wants to know about what types of exercises she can do as she ages, has lots of questions about vitamins, and wonders if there's anything that she should be avoiding. The portal is also for Janine, a healthcare provider who's interested in fall prevention, prognosis related to falls, returning home, or activities that she can help her clients with if they've experienced a fall. And the portal is also for Barbara, who is caring for a spouse with Alzheimer's. I've really just focused on today those citizen users, although the portal is very relevant for healthcare professionals and policymakers, public health professionals, all sorts of professionals that may be providing services or making decisions for seniors and their caregivers. A little bit about the Labarge Optimal Aging Initiative. There are many things that are going on within this initiative, which was all made possible by donor funding from Suzanne Labarge. And what we see, this slide is really just depicting here that some of this funding went towards research funding, so many projects going on at McMaster University looking at innovations around optimal aging and researching those. And then what we're focusing on today is the Optimal Aging Knowledge Translation Enterprise, which is made up, in addition to the portal, stakeholder and media engagement around really understanding and hearing from seniors and others what their needs are around optimal aging. Specifically to the McMaster Optimal Aging portal, there are many pieces that are comprising this portal. At the top you see the terms best evidence, evidence summaries, and that really was something that Anthony Levinson would have covered in more detail last week, and isn't something I'm really going to be showing you today, but just so that you know that there's a great deal of scientific evidence that has all been brought together under one platform that is helping drive some of the other resources that are being generated within the portal. Web resources are one of those what we're calling citizen products that we're working very hard at identifying and finding and looking for ways to make those easily searchable so you can find what you're looking for when you need it. We're developing blog posts. There are email alerts, and then there, of course, all of this being underlined in a way to easily find this information, whether you want to use your own search terms or use a browse category, and I'll be showing you that a little bit later on. So just so that you can put some faces to names, we have Anthony on the left and Dr. John Lavis, myself, Parminder Raina, and Brian Haynes. We are the 5 co-leads of this project and really owe a lot of credit to all the members of our teams who have worked incredibly hard for over 2 years now to get the portal to the stage that it is at now. Keeping in mind that these are early days in the portal, although we've put a lot of work into it and a lot of user testing, we really need your help, users, to continue to give us feedback and help us really continue to develop this resource. So in terms of the key content for today's presentation, we're focusing on the web resources, blog posts, and I'll just mention very, very briefly near the end the email alerts, because these are all products that you can access as citizens, and with the email alerts you can really tailor that to what your interests are. So web resource ratings, and you should know that something that's really difficult around anything you're going to end up putting up on the internet is, what are the right names? And right now we're using web resource ratings. There have been previous names that we've used in the past, and we feel like this really captures what it is we're trying to achieve here. And what it is that we're actually doing is we're evaluating health resources that exist freely on the internet. So at any given day, you can go in, do a Google search. You're going to pull up many, many websites that will talk about that particular topic that you're interested in. It could be fall prevention. And we're looking at all of that information, and we're assessing whether or not it is good quality information that is trustworthy enough to potentially inform your thinking and decision making, for example, about fall prevention. We hope that we would expect this to be useful, a resource that actually helps you sift through what are resources that are worth your time and further reading, and what resources you perhaps might want to either bypass or be a little bit critical in terms of your acceptance of what's been written about in those resources. So how are we going about assessing that quality? So this is actually a three-stage process that occurs in terms of getting to this now database of several hundred web resources that you can search through. So the first stage is really about which websites we are going to include. So we search the world for websites that have content that will be relevant for optimal aging. Once we've decided that that website meets our inclusion criterion, and I will go over those with you in a moment, then we look through that website to identify any web resources, information that exists on that website, and I'll talk about what the inclusion criteria is for that. And then if we've decided that a web resource is relevant and we're going to include it, then we move on to assessing the quality of those resources. All of this happens in a virtual way, so none of this work is paper-based. It's all occurring within an electronic system whereby we find websites, we enter them into the system. Once they've been assessed for inclusion and they pass that stage, then we're queued to add web resources, and then we're queued to assess those for inclusion, and then once they pass that, then we're sent on to a form, an electronic form, that walks us through the process of assessing quality. Two people independently do all of these ratings, and the system identifies if they are in agreement on inclusion or quality, and where there are disagreements, it would then send an email out to those raters identifying for them where there are differences of opinion, and they need to go back into the system and discuss their ratings and come to consensus. So in terms of the websites, what are the inclusion criterion? To be included, a website needs to be not directly funded by a company trying to sell you a product or a service. Needs to be relevant to optimal aging, and needs to be freely accessible. So while it may require you to log in, so creating a login, there needs to be no cost associated with accessing that website. Then if a website is considered relevant, it passes our inclusion criterion, then we find all the relevant resources and add those to the system. We ask a very similar set of questions, not directly funded by a company trying to sell you a product or service, has to be relevant to optimal aging, and we're specifically looking for information that's less than 5 years of age. The age of information really is quite an important issue because the knowledge is changing so quickly about so many types of interventions, medications, and really our sense is that once something is 5 years or older, it tends to be out of date with what the current research evidence might be suggesting, and so that's why we've set that as another criterion. So if we have a website that's passed our relevance criteria, we have a web resource that's passed those criteria and I just went through, now we're ready to assess the quality of that resource. And those resources are, again, assessed by 2 independent raters, and they're assessed on 3 types of categories. One is on their use of scientific research. So to what extent has scientific evidence or research informed what this web resource is saying. So again, if it was about fall prevention and there are some suggestions being given about how to prevent falls, we're assessing the extent to which those actionable messages are informed by good scientific research. The second way in which we assess the quality is whether or not it's the development of that resource is transparent. So knowing who may have developed that resource in terms of a name and how they go about doing that. So some websites actually tell us they have an editorial process, they have a team of medical experts that look through the evidence, and so they give us a type of process. So we're really trying to understand how this resource came into being. And then finally, we're looking at its usability. So we're assessing whether or not for a senior, this resource would be easy to use. So for example, just as examples, you know, is the font easy to use? Is it clear? Or is it really cluttered? Is it hard to scroll through? I mean, just some of the types of things that are behind what we're looking for in terms of ease of use. So there are multiple questions that we ask under each of these categories, and then we combine them to come up with an overall rating that's based on a 5-star, with 5-star being the absolute best quality and a 1 being low quality. These 3 categories, so the scientific evidence, how it was developed, and ease of use, are not all weighted equally. The overall rating is weighted to favor research evidence, so we give more weight to the set of questions related to the scientific research and less weight to the transparency and usability. And that actually is at a 75 to 25% ratio. So we really are primarily interested in the scientific base. And then and then that constitutes 75% of the overall rating, and then the other 2 on transparency and ease of use constitute the remaining 25% of that overall rating. There are many different types of web resources that we will look at. And so this just gives you an example of the type of products that we're looking for. Generally, we've categorized them by whether or not you read them, whether or not you interact with them. So you could be, for example, doing some type of a test. You could be listening to it. You could be watching it. So we've created icons when you pull up the web resources in terms of the type of web resource that it is. Then we also categorize those web resources into the 3 categories listed here. We list them by health conditions, healthcare delivery method, and whether or not it's a healthy aging practice. And I'll show you a little bit more about that in a moment. Then we also identify relevant keywords. So what is this resource about? For example, if it was around diabetes, we would identify words around diabetes. If it was diet and diabetes, we could add that word as well, so that if you're on the site and you're putting in your own search terms to identify resources, then it'll link to these types of keywords. So we think about what are the key ideas that this resource is about, and identify those words, which will then aid in the results that you will get when you run a search to be more successful in terms of being more on track with what you were looking for. And then finally, we identify what the actionable message is for each and every resource. So we read through and think very carefully about really what is the bottom line in terms of an actionable message for that resource, and we provide that for you when you actually go to that page. So just showing you really quickly here that what you will see as if you were to access a resource. So you will see right under, you see the title at the very top, high cholesterol, does reducing the amount of fat in your diet help? We see in the next row is the star rating, and this we see this particular resource received a 3 out of 5. And then you will see below that the summary or the actionable message, which in this particular one, eat less saturated fats in your diet to help prevent heart disease, eat less meat, butter, cheese, those sorts of things. And then under that, you will see the resource type. We see that this is something that you can read and that it is an article. And if you wanted to then look at that article, what is in blue there, you can click on that. That will then take you right to this particular resource. You will see below that the next green arrow shows us the keywords. So one of the things that can be really useful about looking at the keywords, you can see here which keywords we've used to index this resource. And so if you were looking for other web resources, you could use these words as well. If you found that some of your words weren't getting you quite what you were hoping to find, then seeing how we keyworded this particular resource could help inform your future searches. And then in the final green arrow, Browse Menu Indexing, we see related content. So this is telling you what other types of categories, what other type of information is available that is related to this topic that you searched on, and you can click on that and find more information. So there's 2 different ways in which you can search for web resources, and the first way is through browsing a list of topics. So we've put a lot of work, and with the help of a librarian, really trying to understand, to develop a comprehensive list of categories that one could click on to aid in their search. And interestingly, in the user testing that we've been doing, many folks, particularly the first few times that they're on the portal, really prefer to use the browse topics to guide them in their search, as opposed to starting by putting in particular words. So by using the browse function, this will, when you come onto the site as a citizen, and I will show you that in a moment, you will then be searching for evidence summaries, which are summaries that have been written of literature syntheses that exist in the research literature and in the databases that are supporting the portal. You'll be searching web resource ratings as well as blog posts by topic. And some folks have found that this is a really easy way when they aren't exactly sure what the right words are for what they're looking for. So just to show you what that would look like, if you came onto the site, and you can see here where there's the hand and the drop-down menu, so you would be clicking as a citizen on citizen. So I want to search the citizen content. And you can see the very first menu option there is Browse Topics. So if you were to click on that, then you would come to this page. And these are those 3 categories I was talking about a few moments ago, where we have health conditions. And you see here quite a list. You're not seeing the whole list from this screenshot. So you could search by a health condition. You could search by healthcare delivery, so assisted living, community care. You see various options here. or you could search by a healthy aging practice. So a number of them here. I see exercise, caregiving, cancer screening. So you can click on any one of these. So in the example I'm going to show you, this particular user clicked on Alzheimer's and dementia, and when they did that, this is what came up for them. Just keeping in mind, if you were following along with me right now on the site and did this search, you might get a few different things popping up than what I have here right now, and that is because the portal is a living entity, and that we're adding new material to it almost every day. And so a search that I might have done yesterday and taken the screenshot for might look a little bit different today because we may have added something new. Something new may have been posted, let's say, this morning. So anyway, what we see here after we've clicked on the browse category of Alzheimer's and dementia is we see what comes up here is a web product, so one of these web resources. Alzheimer's disease, can Ginkgo products help? What we can also see is that this web resource has been given an overall rating of 5 stars, which means it is good quality. It's the highest quality that it can get. What we also see on this page then are 3 evidence summaries that also exist in the portal that can be accessed. So to access any of these, one would just click on the blue title, and if we did that on the very first product, then we would go directly to the web resource product page, and that's that first link there. It takes us right to this page. We can see here now the summary, and if we wanted to, we could go right to this article and take a look at that. The other way that you can search for web resources and for any of the citizen content would be to put in your own words. So this can also be very helpful because then you can tailor the search right from the very beginning more to what your specific interest is. So if, for example, it was high blood pressure and medications, you could put those words in, with the intent being that more quickly you will end up with the results that you are looking for. With the search findings will be more relevant to what you are looking for than if you search the browse category under hypertension, for example. You know, with the hope that all of this makes that user experience that much more useful for citizens. So if we can, I'm just going to walk you through an example here. If we come back to Linda, who is interested in wellness, exercise, vitamins, what to avoid, and if Linda came onto the site and wanted to do a search, we would, and this actually, she would have been prompted to log in, and once she's done that, she can put into this box right in the middle of your screen, let's say she has an interest in vitamins. So she writes in the word vitamins, she clicks search, and she ends up finding this page. So let me just tell you a little bit about what is on this page. The first thing to note is when you do a search like this, so putting a word into that box when you first come onto the site, the system is set up to default to showing you evidence summaries first, and that's where you can see that green arrow at the top of your, near the top of your screen that shows you that. And so what is directly below you are 10 evidence summaries, the titles of 10 evidence summaries. We can also see where they've been published, which reviews those evidence summaries are based on and where they've been published and what years. And we can also see the quality rating of that evidence. And we can see here that of these ones that we can see, they are all high quality, either having a 5-star or a 4-star. If I bring your attention over to the right-hand side box, you will see a list there that starts with telling us in the system, in the portal right now, we have 10 evidence summaries that have been categorized, keyworded with the word vitamins. We have 49 web resource ratings that you can take a look at, and we have 5 blog posts. And if you were to click on any one of those sections, then the screen to the box to the left will then pull up the results for whichever one. So if we click now on web resource ratings, if we were in the system, then our box to the left will then show us those web resources. If I just show you, that's for the citizen side, what they will, what they can access. For citizens, that's specifically set up for citizens. We also have a lot of content that is relevant, useful for professionals. Citizens can also look at this information as well. We just distinguish between what are products that are for direct use for citizens versus those that come more directly from the scientific literature for professionals. So we see for clinicians, and in what we call MAC+, the clinician database, there are 743 entries or items there that are relevant for vitamins. In the public health professional database, there are 22 systematic reviews. And in this particular example, as it relates to vitamins, there aren't any resources that are that would be relevant for policymakers. So I'm just going to move us along here. So if we had wanted, as I was showing, if we had clicked on the web resource rating, now we see that we see the first 10 of 49 results for the web resource ratings. And if we clicked on the first one, then we go directly to that page about preventing osteoporosis. And when you first come onto the site, you will have something pop up that is, well, what is web resource rating? What is it? And it'll tell you a little bit about it. And then you could choose to hide that information. So we understand that there's a lot going on in the portal, and we're trying to make it as user-friendly as possible by providing some hints along the way of what certain things are, and then you can choose to not see those things again once you are clear what they are. So again, this just shows you the title, the star rating. We see that it's a good one. We see that the actionable message is listed there. We see that this is something that you read. It's a fact sheet, and if we want to go directly to the fact sheet, we would click on View this fact sheet. And then again, at the bottom, we can see what types of keywords were used, and we can also see that there's other related content that we could click on if we wanted to go there. So one of the things that we can do is in this same session, so Linda's come on to the portal, and she's done this search about vitamins, and we've seen that it defaulted to evidence summaries. But what if she was mostly just interested in seeing web resources? So she could click on this menu as I've shown here, and say, you know, when I run my keyword search, I just want to see web resources. So you can click on that, and then you'll end up seeing that this will still produce the same set of 49 web resources that I was just showing you. It's just a way to get this screen coming up first, as opposed to having to do that extra click of saying I want to look at the web resources. The other thing that we can do, now we've set that we want to look at web resources, and this could be the same session that Linda is running, she's searching for, and she's now decided, well, I wonder what there is on exercise. So she types in exercise, she hits the magnifying glass there, and now we see that there are 88 web resources relevant for exercise, and her screen would be showing the first 10 of those. Again, here we see the first one is the same one we just looked at in the previous example, receives a 5-star. We see the one below that is a 3 out of 5, as well as the next 2 below that. If you move your eyes over to the right-hand side, our box, we would see that there are also 28 evidence summaries that are relevant for exercise, 13 blogs that exist, and then you can see that there's a fair amount of literature, research literature that you could access from the clinician database, the public health professional database, and also for policymakers. So that's the web resources, and I'm just going to move on now. I've talked about what the web resources are and how we're assessing the quality of those resources, and then I've shown you two different ways in which you can search for those web resources on the portal. So now I want to move on to talk a little bit about the blog posts or blogs. And these are commentaries in real layman's terms about what the research really means. So currently we're identifying high quality synthesis of the literature that we are writing what we call evidence summaries. So these again are putting into in a short and concise way what these summaries are about and what the findings are. A blog really puts that into really accessible, easy to understand, short, concise commentary on what that research really means. They're useful because they take out that research jargon. It's printed in an article format. They're really short and really get in terms of identifying what the bottom line are. In terms of how the blogs are being developed, there are a couple of different ways in which they are being done. Some of the focus right now is identifying really high quality synthesized research evidence. And then a professional writer then looks at a summary of that evidence and writes the blog. This is edited by an expert, which is within the health evidence team. So myself and as needed, other experts provide editorial feedback for accuracy of the information in the blog. And then that blog is indexed with other material on the site. And so, for example, we want to make sure that if you're reading that blog, you can easily access the evidence summary it might be based upon, as well as the synthesis, the literature review that it's also based on, in case you want to access all of those. And then we post them to the site. Again, there is more than one way in which you can access the blog. So I'm going to show you those two ways now. So again, you've come to the home page of the portal. You click, you're looking under the citizen tag. You can click on blogs. And if you do that, then you come to this page, and this page really is listing all of the blogs. So currently we have 43 blogs on the site, and we are adding to these on a regular basis. So you need to check in regularly because the information will be added to on a regular basis. So you can click here but you can search for blogs under categories. So we've listed here, you can see down the left-hand side of your page, the types of the categories that currently have blogs within those categories. So for Alzheimer's and dementia, back pain, bladder, urinary, pelvic problems. So if you were to click on these, then that will take you to all the blogs relevant to those topic areas. And then the ones that you can see in the middle of the page here are ones that have been newly added to the site, and you could just go and click on the title, and that would take you directly to that blog. So let's work through a couple of examples here. So we have Janine, who's a caregiver, who's interested in falls prevention, prognosis, returning home activities. And so she's gone to she's gone to the home page. She's clicked under Citizen. She's saying, I want to see blogs, and she types in fall prevention. And what this result shows us here directly below that is that there's one blog called Exercise Programs Can Help Reduce Falls and Prevent Injuries. And we can click on that. That will take us right to that blog. And just to show you before we leave this page, we can see down now the right-hand box as well that there are 4 evidence summaries, there are 9 resource ratings, as well in the professional database, other scientific evidence that could be accessed. So Janine clicked on that blog, and then this is what comes up. A picture that really tries to ground what that blog is all about, the title, And now you can see, and this is the beginning part of the blog that's included here for you. And this is really, the blogs are really divided into some key sections. There's some background. So what are the issues around falls in seniors, which is some background information that you can see here. The next section really focuses on, so what do we know from the research? What does it tell us? And then a nice box at the bottom of the blogs that tell us what is the what is the bottom line in bullet format in terms of what are those key actions that you could do. So let's look at another example here. We have Barbara who's caring for a spouse with Alzheimer's. And again, she's come onto the site and she's clicked on Citizens. She wants to look at blogs and she's typed in memory problems. And we can see here directly below that we are seeing 10 of 11 results for blog posts. And we see here again the title, and we see, you can click on that, we can see who's written them. And if you look to the box now on the right-hand side, again, you can see what other products and information exists when you type in the word memory problems. So actually, wait, I'm just going to back us up here. Barbara clicked on the first one, which is treating behavioral problems, and that took her directly to this blog post, which then gives us, you can see the blog there. So the final thing that I really just wanted to comment on here are the email alerts. And email alerts is your opportunity to really customize your experience with the portal. So by going in and registering and creating a profile for yourself, you can identify which topics are of most interest to you. And from there, we'll be able to push that very tailored information out to you at a time interval that you choose. So it could be that you only want to receive things once a month, or maybe you want to receive something once a week. This allows you to have control over the quantity and the type of information that you will receive. So it can be a really powerful tool to make sure that you are getting exactly what you want from the portal. It's a way to keep up to date on new emerging research or new blogs as they come out. It's a quick and easy way because we're doing this searching around the world for all of this information, and if we know what your interests are, we can get that to you. So this is just an example of an alert that Anthony Levinson would have received probably a couple of weeks ago, maybe last week. And it starts with the evidence summaries, and again, it's giving you the title, tells you where it was published, and it gives you a sense of the quality. So we can see here from this page, both of these evidence summaries received 4 out of 5 stars, good quality. And then it continues on in that same email alert what web resources would have been sent to him. We can see here from 3 very, very different types of web resources that Anthony likely hasn't identified a particular topic area that he's interested in, which is also fine if you wanted to be aware of anything that was coming in. And so the last piece that I'll just talk about then is registration and a little just identifying for you where the help is. So as I was saying, what really is so important about registering is it provides you one-click access to all of the information when you come onto the portal. And it allows us to really tailor what you receive to your interests and needs. And then just to really alert you that when you come onto the website, you can see these green boxes that say register. We ask for just minimal information in terms of that registration. It is really important that if you do click on the registration, there's a confirmation process. So you will receive an email back, and you need to click on that link in order to fully engage the registration process. So that's something really important to keep in mind, that if you do register, to be on the lookout for receiving this email from the portal, because it isn't until you click on that link that then you've really initiated your registration. And then finally, around help, we know that there is a lot of information on the portal. There's a lot going on the portal. And so one of the features that we've been working on is a fairly extensive help section by topic. And so here, this is just showing you again on the home page the help button that you can click on, and you can browse that to look up any particular issues you might be having, or to even, to help you with your searching, any of those types of things. You can find that information here. And just in terms of acknowledgement, again, this is funded by the Labarge Optimal Aging Initiative at McMaster University, and of course, I'm really happy that the McMaster Health Forum invited me to come and present this today. So thank you very much, and I see we'll have a few moments for questions. So I think I'm just going to turn it back to you, Kaylin, for a moment.
We had 3 different questions come in from one of our participants. The first is the portal the first of its kind?
That's a great question, and yes, to our knowledge, we are not aware of any other initiative that really is pulling together under one platform 3 best-in-class databases. So I didn't really talk about that a lot today because we were focusing on the web resources and blogs, but really what is the underlying body of evidence that is supporting the entire portal are 3 databases that search the world for the research evidence on what to do about my health, so individual or evidence that's relevant for individuals, research evidence that's relevant for groups and populations, and that's public health, and then research evidence that's relevant for policymaking and health systems. And these 3 databases, which have existed individually up until now, search for that evidence, are comprehensive in their search, assess the quality of all of that evidence, and then have packaged that for those particular audiences, policymakers, public health professionals, and clinicians. What the Labarge Optimal Aging Portal has allowed us to do is to bring these 3 resources under one roof, and with one click of a button be able to search all of those at the same time. In addition, then we've added to that then this initiative in terms of finding the evidence that exists on the internet or out in the web that isn't research-based, but that really the majority of citizens might spend most of their time looking for. So if you're doing a Google search, you're going to be finding this type of evidence, and we know that it's incredibly difficult to really distinguish between what is good and maybe what isn't as good and perhaps shouldn't be really influencing your decision making. We've created a way to assess that and to make that information easily searchable and accessible, and then bringing together with that the putting into even more plain language using the blog posts, the email alerts. There really isn't anything else in the world that would do that, and really bringing that, I guess the expertise that McMaster really brings to that is their focus on the basis of using the best scientific evidence to really guide what we're doing.
Great, thank you, Maureen. The second question that came in was more about some of the operationalization of the key terms that we use. So one of them was older adult. So could you please help us understand how we're defining older adult?
Great, thank you. Good question, and hopefully I don't get myself into any trouble here. But you know, we have defined the population as 60 plus. So in terms of when we really, it's like casting the net into each of our databases, looking for research evidence. We are looking for participants in those studies to be 60 plus, and so that's what we've defined in this instance as older adult, and also then caregivers of folks who would be 60 plus is really what is guiding us at this stage of the portal's development.
Great, thanks again, Maureen. The final question that we have, there's another one that's coming in now, but there's another one that popped up earlier, and it's more related to the process of getting the content into the portal. And the question specifically was, who are the independent raters that you mentioned?
That's a great question. So right now, if it's related to the web resources, those are staff that work at healthevidence.org with me. They can really be a variety of folks, and likely will change into the future as the portal evolves. But right now, this is primarily being done by research assistants who may have completed, for example, a health degree. Some of them are students that are currently working on an undergraduate degree. Some of them are graduate students here at McMaster University who are working on this. So it's a combination. We have some plans that are currently being developed to significantly engage undergraduate students at McMaster University much more fully in the portal, in the generation of content for the portal. So we'll be working on that over the next few years. And my hope into the future is to explore whether or not citizens would like to be involved in working with us around that. So there's lots of opportunity for many different folks to become involved with the portal. And certainly if you have ideas or are interested, please don't hesitate to contact me and let me know about that. And we'll be continuing to work on that in the coming 12 to 18 months.
Great, thanks again, Maureen. So the last question that I've got in here, and there's still time for one or two more, so if anyone has a question that's burning, please feel free to enter it into the chat and I'll record it down for Maureen. The next question, Maureen, is from Karen, who said a lot of our clients are trying to make sense of information given by holistic practitioners compared to traditional sources, so I take this to mean physicians and nurses. And the question is specifically, does your rating or inclusion system allow for this type of information, or is it more medically related?
So that's also a really good question, and I guess there's really quite a bit of layers to that. It is likely that some would think that the rating tool that we've created that is heavily based on scientific evidence might say that it's more medically oriented, so our ratings are more medically oriented. I mean, if I back up a little bit and say, when we are searching for websites and then web resources, we aren't giving any preferential treatment to an organization that might be more traditionally medical or medically focused, or let's say healthcare provider, nurses, physiotherapists, physicians. So we aren't necessarily looking for that more than any other type of information. We're really being guided by topics and where are there gaps. So what are, if we know that there are priority issues around memory and cognition, and around social isolation, and around the built environment and walkability, things like that. So based on priority topics, we are then searching the world for websites that might have information that would be relevant, suitable for citizens. Once we've deemed that website meets our inclusion criteria, which again it's not someone or somebody or an organization trying to sell you something. It's relevant for those that are 60 plus, and it's freely available. Once it passes those criterion, then we're looking for particular information or web resources on that website. The criterion, however, once that resource passes through to being assessed for quality, is it is asking, so if claims are being made about something you should do or something you shouldn't do, then what are the basis of those claims? Do they come from single studies? Do they come from a synthesis of the literature? Has the quality of that literature been appraised so that we know it's good evidence? If recommendations are being made, are the quality of those, the strength of those recommendations discussed, and how that happens? So some might think that that's a much more medical type of focus, particularly if there isn't that type of evidence-based in certain holistic practices. So I'm not sure that that might really fully answer your question around that, but that's probably the best answer I can give you at the moment.
Okay, thanks, Maureen. One more came in from Karen, and the question is, if a resource is identified by someone that isn't featured on the portal, is it possible to submit, and if so, who can we submit it to? And I know this came up last week in the webinar. Someone asked the same question, given the fact that your team is working endlessly to try and include all that they can, but it would be great to know if someone identifies something, what they can do with that as well.
Yeah, so that is really a good question. I'm glad you asked it. So there is a feedback loop. There's a contact us on the site, and definitely if you know of a website or a web resource that you don't see on there, you don't necessarily feel like you need to exhaustively search for it. If there's something you just know about, you can send it to us, and then we will put it in the queue and do our best to get to that as soon as we can. So there's lots of different things that you can provide feedback on as well. So far, just since our the public launch on October 1st, we've had some folks write in saying, really interested in getting involved, volunteering. There's a contact, using that contact button will send that information to us, and we get that information, and we've been able to respond back to those folks. So if there are, really anything in terms of feedback, websites, something that maybe you're having, some challenges with, you love it and you want to tell us, we'll take the good, the bad, but please, just use that. And we definitely have folks that are constantly looking at the feedback that we're receiving and suggestions and acting on them.
Okay, and if there aren't any more questions, I'd like to thank Maureen for her presentation today. This now concludes our webinar, and I think Maureen's contact information is now up. So if you have any specific questions that you didn't get to pose during the webinar today, I encourage you to follow up directly with Dr. Dobbins via these channels. We'd also like to take this opportunity to let you know about a few other upcoming Optimal Aging events. Just to flag for everyone that the last slide in this presentation, which will be left up for a few minutes after I'm done speaking, will include all of the links and website addresses you will require to obtain further information on these events. So if you don't get it all from the blurb that I'll be sharing with you, you can always follow up directly via the website or through one of the other channels. And as I mentioned, I'll leave the slide up for a couple of minutes afterwards so you can take the opportunity to write it down. So the first one is coming up. Everyone is invited to a free Optimal Aging event series continuing with next week's public talk. It's being presented by Dr. Mike Evans, who's Associate Professor at the University of Toronto, Director at the Health Design Lab, and a scientist at the Keenan Research Center, Li Ka-shing Knowledge Institute at St. Mike's Hospital. So the event will take place at the McMaster Innovation Park in Hamilton, and that will be on Monday, October 27th from 7 to 8:30 p.m. It will also be streamed online, and the link will be provided at the end of this as well. So that's the main announcement we have today. Again, thank you for participating. We also like to thank Dr. Maureen Dobbins for giving her time today to share with you the Optimal Aging portal with a specific focus on the web resource rater as well as the blog function. I think it was very helpful for me, even someone who works on the portal, to see how all of these things are coming together in a very user-friendly way. And as I mentioned before, here are all of the channels you'd need to find out more about that event with Dr. Mike Evans that I just mentioned. You can follow up directly through any of these sources. So thanks again, everyone. That's it for me. I'm signing off. Have a great day.